بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. الإخوة والأخوات أعضاء المجموعة الصحية بالمجلس السعودي للجودة، السلام عليكم وأسعد الله مساكم. الإخوة الزملاء المحاضرين، السلام عليكم ورحمة الله وبركاته. يسعدني في هذا اليوم أنه يكون نطلق بإذن الله لأول مرة الفيرتشوال annual meeting للمجموعة الصحية بالمجلس السعودي للجودة. And today we will be having our symposium, and the goal of this symposium, and as you can see in the poster, is in Arabic. I will be fluctuating between Arabic language and English language, but all the presentation will be in English language, taking into consideration that English language is the most spoken language in healthcare services. So my pleasure is to introduce a small report about the achievement of the health interest group. But before I start, and we made sure the speakers and myself to emphasize and deliver a message in line with the vision of the Kingdom of 2030, speaking about transformation and digitalization in healthcare and how important this kind of approaches in the modern healthcare. And what we want is how quality, we want to show how quality adds value to the healing journey in the digital and artificial intelligence era of healthcare. وبالتالي باللغة العربية نود أن نعرف كيف تكون الجودة قيمة مضافة لرحلة الشفاء في عصر المعلوماتية والذكاء الاصطناعي. Today we have a prominent speakers, and they are from some based in the kingdom and somebody from outside the kingdom. We have the speakers from Bahrain, and we have another speaker from Abu Dhabi Cleveland Clinic, Dr. Samir Laham, دكتور نهى من الارم فورسز من الدمام الظهران عفوا. وعندنا الدكتور حاتم شهاب، هو حاليا هو في السعوديه، ولكن حاليا يتمتع باجازته في الاراضي المحتله او الاراضي ان شاء الله المحرره في طول كرم. Without any further ado, I would like to start ahead with sharing my screen to show the 5 slides على الانnual report of the achievement of the health and interest group. ونعرف كم واحد والله knows the health interest group. We are fine, Dr. Mansari. It's just opening.
ما اشتغلت يا دكتور الشير لسه.
Okay, wait. It seemed like something wrong, frozen or something like that. It's everything frozen on my computer.
دكتور صورتك واضحة وصوتك واضح.
Okay, let us see now. Hopefully it's working بإذن الله. Presentation. Just for the first time it says like it give me this prolonged. طيب we'll give it a second. اعتذر طبعا. As much as we could في حلول لها. فخلينا نشوف نحن الآن. طيب إذا هذا مرة ثانية نعمل شيرنج، خليني أرجع إلى.
يا دكتور علق الكمبيوتر، كل اللي كنت بتقوله ما كان واضح، الله يسلمك. ممكن تعيد كلامك؟
أنا بقول إنه التقنية أحيانا هذا، فبالتالي I have to. So why don't you just for the sake of time to start with so you hear me and you can see me.
صوتك واضح والكاميرا واضحة دكتور.
ممتاز. So let me start introducing. By the time I fix my computer, I would like to
الصوت اختفى دكتور نشأت.
She's working as a quality and patient safety director and a consultant of restorative dentist at Armed Forces Hospital.
دكتور المقدمة حقت الدكتورة ما هي واضحة، قطع الاتصال، فريت تبدأ من جديد لو سمحت.
الحين مرة ثانية. Okay. It's my pleasure to introduce the first speaker, Dr. Nuha Al-Muhaysin. Dr. Nuha Al-Muhaysin is a Harvard Medical School graduate with master's degree in quality and patient safety. Currently, she's working as a quality and patient safety director and a consultant restorative dentist at Armed Forces Hospital at King Abdulaziz Air Base, Dhahran. She has a great passion toward quality improvement and patient safety, and looking forward to make a national and international impact in this field. I'm sure that Dr. Al-Muhaysin will have an excellent presentation, and she will be talking about what is value in healthcare. She will introduce the value in healthcare from her perspective as a director. Dr. Al-Muhaysin, the floor is yours. Thank you.
Thank you, Dr. Nash'at. Thank you so much. And I would like to apologize for everyone about this technical issue. Good evening, everyone. Assalamu alaikum wa rahmatullahi wa barakatuh. This is Nuha Al-Muhaysin. Today, I'm going to talk about what is the value of healthcare. Can everyone see my screen? Dr. Nash'at, can you see my screen?
Still the screen is not coming.
واضحة يا دكتورة، تفضل.
Okay, good.
Okay,
Thank
good.
you. So, it's hanging. Okay. So I'll start with the outline of the lecture. First of all, I'm going to start by introduction, a brief introduction. And then we're going to talk about what is the meaning of value in healthcare. After that, why we need value in healthcare. And then how can we enhance value by increasing the efficiency. After that, we're going to cover the value-based healthcare principles, and then some examples of healthcare systems that have implemented value-based healthcare. Unfortunately, you cannot ask questions. So whenever you have a question, you can just write it down, and then we'll open the panel of discussion at the end of the lectures. So starting with the introduction. This is Professor Michael Porter. I don't know if anyone or everyone is aware of him. He's a professor of Harvard Business School, professor of strategy and competitive strategy. He's the author of 18 books and a winner of 6 prizes from McKinsey. And he has a very popular book that's talking about the value-based healthcare, and it's called Redefining Healthcare. So if you are interested in that subject, you want to have more information, you can go to that book and read about it. It's going to give you a detailed information about the principles of value-based healthcare. And I'll be referring throughout the presentation for multiple articles and reviews done by Professor Mike about the rapid increase in the healthcare expenses. So many countries across the world are struggling to improve the healthcare quality, contain or control the cost, and provide access to healthcare for their citizens. There's an increase in the healthcare population, there is increasing in the cost of medication, and there is increased expenses and expenditures related to the healthcare systems. And it's a global. Healthcare problem remains a global issue. So 2 years in the Sustainable Development Goals era, global health spending continues to rise rapidly to reach 7.8 trillion US dollars in 2017, or about 10% of the GDP from US to the budget for healthcare globally, that was 7.6 trillion in 2016. So about 60% of this spending was public, 40% private, and with donor funding representing less than 0.2 of the total. In 2018, that percentage has risen, so it reached 9.8 globally out of the current healthcare expenditure per capita. So healthcare spending versus GDP and income, as you can see, there is an annual increase in the healthcare expenditure, and it reached, like in the US in 2018, 17.2%, while in the UK it had reached 9.8%. In Saudi Arabia, the healthcare expenditure, Saudi Arabia is experiencing a recent rapid increase in healthcare expenditure. In one study, it was mentioned that since its establishment, the Ministry of Health in 1950, it has spent over 73.6 billion US dollars. Of this, 74.6 is from the government and 25.4% is from private expenditures. Saudi Arabia is the largest spender on healthcare across the Middle East and North Africa, and I think we're lucky to have such strong healthcare system, and a priority of the expenditure is going to the healthcare, and we could see this and feel it during pioneering multiple healthcare systems during the COVID-19 outbreak. This is from the website of the Ministry of Health, and you can see that the total budget of the Ministry of Health in 1,000 riyals in 2020 is about 75 billions, 413 millions. So it's about 7.4% out of the total of the state budget. And probably because of the outbreak in 2020, this has exceeded this estimated budget. So we know now that there is a need for a value in healthcare because of the increased global expenditures. So what is value in healthcare? How can we define value in healthcare? So Porter has defined healthcare value as health outcomes achieved which matter to the patients relative to the cost of achieving those outcomes.
Dora,
so healthcare value.
Dora, you hear me?
Yes, I can hear you.
Okay,
sure.
Just you do take your time. Take your time.
Okay.
Yeah, take your time. And there is a slide, I believe you have a poll in it before.
Okay, this one. So what is the value in healthcare? Porter has defined healthcare value as the healthcare outcomes achieved, which matters to the patients relative to the cost of achieving those outcomes. So healthcare value equals to the healthcare outcomes that matters to the patients. So not any healthcare outcomes, it's the healthcare outcomes that really matters to the patients, divided by the cost of delivering those outcomes. So if we look at those three factors, the healthcare outcomes matters to the patients and cost delivering of those outcomes, we can come up with the three elements: improving patient experience, improving clinical outcomes, and then minimizing the cost might result in improvement of the value, isn't it? So that also goes back to the triple aim. The triple aim is the compass of healthcare systems improvement going towards the value of healthcare. So the elements of the triple aim is the population health, the experience of care, and the per capita cost. And that's closely aligned with the value-based healthcare, the lower cost, better care, and better health for patients. So improving value requires either improving one or more outcomes without raising the costs, or lowering the cost without compromising the outcomes, or both. So improving value doesn't mean minimizing the cost on the expenses of the quality of the care that we provide. So next is why value of healthcare. Why do you think we need value of healthcare? So we've known now what is the value of healthcare. So why do we need it? rather than increasing the expenditures, we know that achieving high value for patients must become the goal of healthcare delivery. The goal is what really matters to the patients. So the main customer in the healthcare system is the patients, and that's what really matters to them. And it unites all the interests of the actors of the system. So value improves patients, payers, providers, and suppliers. All benefit while the economic sustainability of the healthcare system increases. So since value depends on results, not inputs, value in healthcare is measured by the outcome achieved, not the volume of service delivered, because what we care about is the outcomes that matters to the patient. So cost reduction without regard to the outcomes achieved is dangerous and self-defeating, leading to false savings and potential. Since value is defined as outcomes relative to cost, it encompasses efficiency. So focusing on efficiency, that's one of the domains of quality, the 6 domains of quality of Institute of Medicine. Efficiency is minimizing the cost by elimination of waste. So the next question, how can we enhance value in health? Touch a few concepts briefly. So the most successful healthcare organizations must not only deliver high quality of care, it should also do that care with the minimum waste. So lean in healthcare is the application of lean ideas that's coming from other industries and healthcare facilities. And that's to minimize waste in every process, procedure, and task through an ongoing system of improvements. So lean is like the medicine for healthcare to minimize the waste in the healthcare system. So while lean focused on eliminating the waste, also Six Sigma seeks the reduction of variation by decreasing the defects. So Six Sigma is the focus or improving of healthcare systems by minimizing the defect and defects based on statistical measurements. So in the last 2 decades, the two systems have been combined into a hybrid improvement process that's called Lean Six Sigma. And there are the 6 domains of waste that's famous for lean. Those are defects, overprotection, waiting, non-utilized talents or underutilized, transportation, inventory, motion, and extra processing. And if you evaluate and examine the healthcare system or assess the healthcare system, you can see that we have multiple and many not improved. This diagram is from the Institute of Healthcare Improvement, and they have developed a balanced strategy of quality and value initiative. And what's interesting that they focus on the 2 concepts of lean and Six Sigma by reducing the defects and by reducing the waste.
دكتورة الشرايح ما it's not updated.
تفضل دكتور نشأت.
الشرايح are not updated. تفضلي الآن ظهرت.
Okay. Okay, I'm going to share my. Can you see it now, Dr. Nashat?
تفضلي دكتورة تفضل. But we don't see the slide yet. The slides are not yet.
Okay, not yet?
Now it's okay, but you can, yes, you can.
Because I'm sharing the screen again.
Okay, good.
How about now? Okay.
It's coming. Just as you know, as we discussed yesterday, sometimes the internet connections varies between place to place.
Yeah, that's true.
Okay, now the slides is on. Go ahead.
So the Institute of Healthcare Improvement, thank you, Dr. Nashat, has also came up with a driver diagram to achieve cost saving through waste reduction in healthcare. And they have implemented this in primary healthcare systems and in the full healthcare system. And they actually designed this driver diagram based on waste reduction and on elimination of the waste and lean methodology. So the primary drivers in those projects were clinical, based on the staffing, minimizing the waste and the patient flow, and focusing on the supply chain management and mismatched services. So what is the value-based healthcare? So now we've talked about the meaning of value, why do we need value, and how can we improve efficiency and how efficiency can impact the value of healthcare. Now we'll value-based healthcare focuses on maximizing the value of care for patients and reducing the cost of healthcare. The strategic agenda for moving to a high-value healthcare delivery system has 6 components, and that's based on the strategy that will fix healthcare by Michael Porter. So what are those 6 strategies or components? First of all is organizing into an integrated practice units. Second is measure the outcomes and costs for every patient. Third is to move to bundle payment for conditions. And fourth is integrate multi-site care delivery system. And fifth is expand the geographic technology platform. And I'm going to speak about each one of them briefly. So starting with what is called integrated practice units. So what are integrated practice units? An integrated practice units is an organized around a medical condition. So we have a team of healthcare providers that are working together based on a medical condition, let's say stroke, diabetes, cardiac patients. So those are a team that's providing a service to a certain medical condition. Care is delivered by a dedicated and multidisciplinary team of clinicians. Providers see themselves as part of a common organizational unit, and the team takes responsibility for the full cycle of care for the condition, encompassing outpatient, inpatient, and rehabilitative care and supporting services. It also includes patient education and engagement and follow-up integrated into the care. The unit has a single administrative and scheduling structure. To a large extent, care is co-located in dedicated facilities, and a physician team captain or a clinical care manager oversees each patient's care process. The team measures the outcomes, costs, and processes for each patient using a common measurement platform, and they, providers of the team, meet formally and informally on a regular basis to discuss patients, processes, and results, and joint accountability is accepted for the outcomes and costs. So this is the ideal framework for the integrated units. So the PUs has emerged initially in the care for particular medical conditions, like I said, such as breast cancer or joint replacement. Condition-based IPUs are proliferating rapidly across many areas of acute and chronic care, from organ transplantation to shoulder care to mental health conditions such as eating disorders. So that improved the communication and the integration of care that we always face and suffer from in healthcare system. One of the examples is the spine clinic in Virginia Mason. Compared with regional average, patients at Virginia Mason Spine Clinic missed fewer days of work. The people were less absent from work by 4.3 versus 9% episode, and needed fewer physical therapy visits, 4.4 versus 8.8. And the use of MRI scans to evaluate lower back pain has decreased by 23%, even as an outcome has improved. So what are the outcomes that matter to the patients? The outcomes that matter to the patients are classified into health status achieved or retained, the first tier, and that's classified into two classification. The survival, example for hip replacement, and example for hip replacement, we have mortality rates. And the second is the degree of health or recovery, and that's, for example, the functional level achieved or the pain level achieved. And in tier, and also in tier 2, that's covering the process of recovery, time to return to the physical activity, and then this utility of care or treatment process, like delays and anxiety, pain during treatment, infection, pain during treatment and length of hospital stay, and pulmonary embolism or deep vein thrombosis. In tier 3, we have sustainability of health or recovery, natural of recurrences, by maintained functional level, ability to live independently, and need for revision or replacement. So that takes us to the second domain, that's measuring outcome and cost for every patient. So to measure the process is not really efficient and effective in improving the value. We need to focus on measuring the outcome. Outcomes should be measured by a medical condition, and outcomes should cover the full cycle of care for the condition and track the patient's health status after care is completed. The outcomes that really matter to the patients, and I talked about them in the previous slide in the 3 tiers. So an example for that is the Cleveland Clinic is Pioneer, and the first published is mortality data on cardiac surgery and mandating outcomes measurements across the entire organization. The clinic publishes different outcomes books, reporting performance in managing a growing number of conditions such as cancer, neurological conditions, and cardiac conditions. There is an international institution, it's called International Consortium for Health Outcomes Measurements, and they develop minimum outcome sets by medical conditions, drawing on international registries and provider best practices. So remember, we need an outcomes that is based on the medical condition, and it's based on the patient's perception of the outcome. So we're going to have poll for this question. So the question is, do you know what PROMs and PREMs are? So would you please answer yes or no? Have you ever heard of PROMs and PREMs before? And do you know what the Can we stop the poll, please, and get the results, if any?
Doctor, only 47% response. Is that
Okay,
adequate?
so can we wait just like a few seconds, please?
Inshallah.
Thank you.
Doctor, is
I hope everyone has
60% enough?
participated.
Is 60% enough?
Yeah, I think it's enough. Thank you. Yes, I would say it's enough. Thank you. Thank you, everyone, for participating. So can everyone see the results? Or should I read it for them?
Everybody could see it, and you can also see it and comment on it.
Good, thank you. So we have a 25%, though we didn't have the full capacity of the attendees participating in the survey, but we have, let's say, a quarter of the attendees, they have heard about PROMS and PREMS, which is good. And there are 75% whom they consider that this concept is close to them, is new to them. So PROMS is an abbreviation for patient-reported outcome measures. And what are patient-reported outcome measures? Those are outcome measures, the type of outcome measures that I've just talked about, that the outcome measure that's tracking the patient's perception or the patient's evaluated by the patients. So PROMS are patient-reported outcome measures, and PREMS is an abbreviation for patient-reported experience measure. So PROMS are questionnaires that's measuring the patient's views of their healthcare status. So it evaluates the quality of the care. There is a questionnaire that's submitted. Yes.
Could you please close the camera, all speakers? If you could close the video, please, so the connection will be much better, because your voice is going up and down. So in order to make it better, close the cameras, speakers, and then we'll see how it goes with the voice.
Sure.
Thank you.
Okay, welcome. Just give me 1 second.
دكتورة, you could continue, دكتورة المحاضرة.
Move it a little bit. So what are PROMS? PROMS are patient-reported outcome measures. Can you hear me, Dr. Najat?
Yes, I can. Good. Thank you. Go ahead.
Thank you. So those are questionnaires that are submitted to the patients before doing or receiving treatment, and then the same questionnaire is submitted to the patients after they're done with the treatment. That's to evaluate the quality of care. While PREMS is a way to measure patient experience by looking into the patient's perception towards one of the procedures or the medical conditions that they have been managed for. And here you can see some surveys that have been used. The first one is a CARE patient feedback measure. It's for patient PREMS, the patient-reported experience measure, and the second one is for the PROMS, the patient-reported outcome measures. So those are implemented in multiple countries. It's a bit a new concept, and some hospitals are really finding an improvement in the value and minimizing of the cost after implementing the PREMS and the PROMS. Though there is no, I don't believe there is still strong evidence in relation to those new outcome measures. So measuring the cost. To determine value, providers must measure cost at the medical condition level, tracking the expenses involved in treating the condition over the full cycle of care. So most hospital cost accounting systems are departmental based and not patient based. And the absence of accurate cost information in healthcare is not really surprising. The best method for understanding these costs is to use a time-driven activity-based costing, which is called TDABC. So another example from Virginia Mason, they found that it costs $4 per minute for an orthopedic surgeon or other procedural specialist to perform a service, while it costs $2 for a general internist and $1 or less for a nurse practitioner or a physical therapist. So in light of those cost differences, focusing the time of the most expensive staff members on work that really utilizes their full skill set is hugely important. So the third element is to move to bundled payment for care cycle. So neither of the dominant payment models in healthcare, whether global capitation and fee-for-service, really directly rewards improving the value of care. The payment approach best aligned with the value is bundled payment that covers the full care cycle for acute medical condition or the overall care for chronic conditions for a defined period, which is usually a year, or primary and preventive care for a defined patient population, like healthy children, for instance, or other type of population. The fourth is to have an integrated care delivery system. So a large and growing proportion of healthcare is provided by multi-site healthcare delivery organizations. So there are hospitals that have multiple sites and different places. So to achieve true system integrations, organizations must grapple with 4 related sets of choices. First of all, defining the scope of the services. Second is concentrating volume in fewer locations, and then choosing the right location for each service line. So if we have a high demand in one area, we're going to locate this service at that area. And then integrating the care for patients across the locations. Number 5 is expand geographic reach. So geographic expansion takes 2 principal forms. First is the hub and spoke model. And for this model, for each IPU, satellite facilities are established and staffed at least partly by clinicians and other personnel employed by the parent organization. And in that model, clinicians can rotate among locations, which helps staff members across all facilities feel they are part of the team. While in the clinical affiliation, which an IPU partners with community providers or local organizations using their facilities rather than adding capacity. And we can see multiple examples if you reflect on those models in healthcare systems that are in Saudi Arabia, whether governmental or private, that they are really having multiple satellite facilities, or they are collaborating with other institutions and entities. An example is MD Anderson Center. They developed a hybrid models that include the approach taken by the MD Anderson and its regional satellite program, which leases outpatient facilities located in community hospital campuses and utilizes those hospitals' operating rooms and other inpatient and ancillary services as needed. Another example is from Cleveland Clinic. So the Cleveland Clinic's Heart and Vascular Institute. Heart and Vascular Institute is one of examples of the IPU systems. So it's a pioneering in IPU in cardiac and vascular care. And it has 19 hospital affiliates spanning the Eastern Seaboard. So the 6th element is built an enabling information technology platform. And the role of information technology, I think, is increasing with the years. So a value enhancing IT platform should have at least the 6 essential elements. It has to be centered on the patients. And in the next slide, I'm going to show the new strategies of engaging the patients in the electronic platforms and the healthcare systems. Second, it uses a common data definitions. So it can share information between the systems, so the systems can talk to each other, and then it encompasses all types of patient data. Number 4 is the medical record is accessible to all parties involved in the care. And then the system includes templates and expert system for each medical condition. The system architecture makes it easy to extract information. So one famous example for engaging patients in the medical record is the OneNotes, the Open Notes. So the Open Notes is a way for the patients to get into their own medical records. They can read the notes of the physician, they can comment on it, and they can write. And there are multiple hospitals that have implemented the system. BI Hospital, that's one of Harvard affiliated hospital, has implemented this system. And in the US, by 2018, more than 30 million patients have accessed their clinical notes. So engaging the patients in the electronic healthcare record is also going to improve the value of healthcare.
5 minutes.
Sure. So the next example is Choosing Wisely. And Choosing Wisely is also a new way of engaging patients in deciding the value of the healthcare and the minimizing the waste in medical tests, treatments, and procedures. So value-based healthcare benefits can be to the patients by lowering the cost, to providers by increasing the patient satisfaction, to the payers by having stronger cost controls and reducing the risk, to the supplier, and to the society. Some examples of healthcare systems that have implemented value-based healthcare. So I've looked into this study and I found this really interesting. It's done in August 2020, and it studied the implementation of the value-based healthcare elements in multiple systems in Massachusetts, in the US, and Netherlands, England, and Norway. And those systems are variable between private and public. So you can see that the main elements that was implemented is outcome measurements throughout the systems, and also the value-based reimbursement, whereby the hospitals and the healthcare providers are going to be paid based on the outcome measures, and then the information technology. So probably even the full set of the value-based healthcare wasn't really implemented everywhere. NHS has different definition for value-based healthcare. They define it as the healthcare that's equitable, sustainable, and transparent use of available resources to achieve better outcomes and experiences for every person. The CMS, the Center of Medicare and Medicaid Service, defines value-based healthcare as those programs that reward healthcare providers with incentives payments for the quality of care they give to people with Medicare. And they began emphasizing the value-based quality healthcare over the quantity for provider visits since 2008. They have also what is called accountable care organization. So it's designed by the CMS to provide high quality medical care. And in the SCO, healthcare providers work as a team. The care is coordinated and at the lower possible cost. And each member of the team shares both risk and rewards with incentives to improve access of care, quality, and patient and healthcare outcome. This approach differs from fee-for-service, in which individual providers are incentivized to order more tests and procedures and manage more patients in order to get paid more.
دكتورة ممكن تخرجي
They also have recently.
Hello دكتورة نهى، لو تكرمتي ممكن تخرجي من السلايدز شو، خلي السلايدز اللي هي you can see all the slides and هذا the frame. It's better.
Yeah.
That's لأنه it's not changing the slides and the slide هذا show.
Interesting. Okay.
Yeah.
Anyhow, that's my last slide, Dr. Nashat.
Okay. Thank you.
Yeah. I'm going to share it again. Is it clear now? So the CMS has recently implemented a value-based purchasing program that ties reimbursement to quality or value, identifies person and community engagement as one of the four key domains for value-based healthcare and value-based purchasing. So they include patient experience in the organization reimbursement. So they decide the budget of the hospital based on the results of person and community engagement as measured by patient experience. And they add it to the other measures of safety, clinical care, efficiency, and cost reduction. And there is a very important thing, that the most underutilized resource in all of healthcare is the patients. So the way we engage the patients is going to definitely impact the healthcare system by taking the decision that matters to them, and by multiple ways and techniques. And I would like to thank you a lot for listening.
Thank you very much, Doctora.
Thank you, Dr. Nashat.
Allah yabarik fiki. We will make a question and answer at the end of the session with all speakers. So without any further, thank you very much, and really interesting subject. And I took so many notes while you are talking about this subject. So, and I like one statement you said, that the patient is the underutilized resource. That's really true. While the major focus of quality is the patient as a center of care.
That's true.
Thank you very much. So without any further ado, I would like to introduce the second speaker. The second speaker is not only a colleague, it's not only a friend, it's a brother. He's a brother to me. He's a person, so I always eager to listen to him, learn from him, see the wisdom and how really quality impact not only the processes of the healthcare, but how it's changed the lifestyle of those healthcare providers. Dr. Samer Laham is currently a Cleveland Clinic caregiver, and the word caregiver is something that touched the heart by when I say it, because he's not only a clinician he's a caregiver, and seconded as a senior cardiovascular consultant and director of accreditation in the Quality and Safety Institute in Cleveland Clinic, Abu Dhabi. He is the Middle East Regional Chair, Patient Safety Movement Foundation. He's an ISQA expert. He's a member of the Accreditation Science Committee of the American Hospital Association, AHA, member of European Society of Cardiology Heart Failure Writing Group. He's an ex-Middle East representative of the JCI Standard Subcommittee and American College of Cardiology Accreditation Foundation Board member. On top of that, if you don't know Dr. Samer Laham, Dr. Samer Laham, you learn from him all kind of tools in how to implement in healthcare. He's a figure I'm proud to introduce him. He's not only a figure in quality, he's figure in humanity. He has a very touchy heart and very sensitive approach, welcoming approach, loving approach to his colleagues in the field. And as well, he's a co-founder, or founder of the Middle East Equality Conference every year that held in Dubai during Arab Health. And he's been with us as a partner, as a mentor, as a caregiver, quality caregiver for the last, now I could say 7-8 years, 10 years, yes, almost 9 years, inshallah. Inshallah, it will last long. With my this humble introduction to him, I would like to invite him to the stage to speak about artificial intelligence, something that he loves, and the blockchain, which I don't know how to use it in healthcare, are the key to healthcare innovation. Dr. Samer, floor is yours.
Yani Nashat, I'm blushing and flushing. Are you sure you're talking about me or somebody else?
No, sir.
الحمد لله من غير حول منا ولا قوة بسم الله والحمد لله والصلاة والسلام على رسول الله. First, my love to Saudi Arabia, the country of purity, of decency, of barakah, of love, north, south, east, west. Saudi Arabia is not a country. Saudi Arabia is our soul. So there is no way to express to you in Arabic, English language, or any language, the love, the respect, the admiration to this nation that's full of love and nothing but love and respect. Second thing, Nashat, يعني أن الإناء بما فيه ينضح. You're talking about yourself, maybe reflecting on me. Inshallah, what we're doing is dedicated not for سمعة or for anything else, but for doing something مفاتيح للخير مغاليق للشر إن شاء الله. And thank you for the whole council. All the figures that you show are friends of mine, and I love them so dearly. All the way from Saudi Arabia to close to Tulkarm, and he's going to be the next speaker. He's a very dear friend. So with that in mind, I was asked to talk about innovation in the context of a very important topic, which is digital health. So I just want to first give you a few words about this before we start moving with the slide. Technical support, if the slides are not moving, immediately send me a message to give you full control of the slide. If at any time my voice is not clear, Mr. Nashat Habibi, just let me know, so we all feel like we are together as a family doing something that will benefit our community and all our patients. So artificial intelligence and blockchain, number one, many times are not understood at all, or misunderstood, or they are hypes, yani not really true things. They are just something fun to talk about, a toy that we can discuss and have few publications on, and that's it. This is obviously, if you know me, not at all the goal. I got interested in this around 3 years ago. Every 3 years I have new goals in healthcare. While my first passion is always to do the right thing, my second passion is cardiology, my third passion is quality, safety, and risk management. This is my fourth passion now. So what I'm going to do is try to bring up something important, but simplify it in a way that touches your heart. My public speaking rules will never change. And now Nashat will smile. Tell them what you're going to say it, and then summarize what you say. I'd like to stand up and do my usual moves, but it's not going to work very well virtually. So the only challenge that comes up in these cases is that the slide will move. Are they moving? Nashat, are the slide moving? Nothing to disclose?
Yes, disclosure.
Okay.
Yes, no.
So if at any time they are not moving, Nashat is my slide motion indicator. So this is the outline. I'm going to talk briefly about introduction, healthcare innovation, just a couple of words and put a smile on your face. AI in general, AI in healthcare, blockchain in general, blockchain in healthcare, conclusion and future directions. And I'll be on time. Intro. So first, you give credit to the people that support you, that teach you, that educate you, that pay your salary. And it is really Cleveland Clinic. This would be my 12th year with Cleveland Clinic in Ohio. And this is not to publicize an institution, but truly I've been treated for 12 years, almost like I'm treated by my parents. An amazing institution, not only the name and the love for cardiology and innovation, but also they treat us truly as human beings. And I'm also blessed to be in Cleveland Clinic Abu Dhabi, the daughter, if you like, of Cleveland Clinic, working with a wonderful system called Mubadala. And again, I feel privileged, not only because the building is amazing, it oversees the sea that I love so dearly, but more importantly, it's truly a humane institution, very strong, but also full of empathy. I'm a cardiologist still, and my tears can fall easily, as some of you know. I'm still, alhamdulillah, very sensitive and very caring, inshallah, about the patient. Around 3 years ago, I was asked to be on the editorial board of telehealth, journal and the blockchain. Who likes honesty? Raise your hand. At that time, my knowledge base of telehealth, telemedicine, digital health, mobile health, blockchain, and artificial intelligence was 1%. And this is totally honest. But they saw that, we were publishing a little bit on this and there was a passion. So they were kind enough to include me on the editorial board, and I learned a lot from the group, so I give them credit. This is the institution where I work. There's just some of you may like to visit us anytime through the council and through my brother and colleague, Nashat. You let me know and I'll make the visit a go. Another thing I want to give credit, لا يشكر الناس لا يشكر الله. جامعة Khalifa University, a group of genius angels led by my colleague Khalid Salah, who is a figure in blockchain internationally, not just in my beloved UAE. And I'm being honored to be on the group, the only physician really. And then Mohammed bin Zayed, bless his soul, decided around 24 months ago, have an amazing institution that focuses on artificial intelligence, a university on artificial intelligence. So, all of that is great. Now, why do I show the slide? I show the slide to reinforce the fact that, this is a complex environment, healthcare. All of us are caregivers. So our motto in Cleveland Clinic, Ohio, and Cleveland Clinic, Abu Dhabi, is that we're all caregivers. So the nurses are equally important to the physician, the administrator equally important, extremely important is medical record, electronic medical record, patient access and operation. Again, how to align? You align when the patient is the focus, and I'd like to call patients not patients, but I'd like to call them persons. الإنسان قبل أن يكون مريض أو تكون مريضة. And really, those patients have 3 requirements. They want to be safe. They want to be healed. And they want us to be kind to them. And one of my dear colleagues will be talking about patient experience. If you want to add a 4th one, I'll easily add engage me, get me involved in the care. So this is just show you in a pediatric unit in a prior institution where I used to work, that obviously, Sheikh Khalifa Medical City. You can imagine this is a baby. Look at how many tubes and how many things the baby has. And some of you may have had this on your own baby, and it will probably ring a bell. And imagine how many mistakes we can have and how much the mental stress is and how much a minor distraction can be lethal. Imagine ordering a Panadol. Panadol, I did not say chemotherapy. I did not say warfarin. I did not say heparin. I said Panadol. How much Panadol, how many steps it needs to be prescribed. So we're dealing with a very complex system. Just look alike, sound alike medication, right? Epi looks like sodium bicarb, lidocaine. I'm sure you know about the case in Chicago, 9-year-old. They wanted to give the baby normal saline. Then for some reason, there was something wrong with the hep lock, and which should not be a hep lock, should be a normal saline lock. The nurse wanted to inject with heparin, by mistake injected insulin, and the patient died in front of the mom. And again, this can happen to all of us. So many things are happening to the amazing brain that Allah subhanahu wa ta'ala has created in us, that it is okay to have a digitally augmented healthcare, not replaced. We're not talking about healthcare being replaced. We're talking about augmentation with artificial intelligence and with digital health. Again, healthcare is no longer as simple as it used to be. This is healthcare now, and this is healthcare at the present and the future. So not understanding digital healthcare is extremely important, and it will be a huge challenge. Excuse me. So healthcare innovation, what do we mean by innovation? Innovation is practically creativity that's being implemented. That's kind of basically what it is. So في الابتكار وفي تطبيق الابتكار. So innovation is the application, the implementation, doing the creativity in a format that adds value, improves, and makes patient care and healthcare better. Why? Because healthcare is not healthcare, as you heard me say this 100 times. Healthcare is sick care. It's reactive. It's advanced, but not reliable. That is the problem of healthcare. So with that in mind, and this is just to put a smile on your face, a fish is looking at another fish. Are you the next Google? No, I'm a goldfish. And the message here is that I'll show you examples where we are now in digital healthcare, you know, and if I ask you a question now, what's the power of Google Translate? The power of Google Translate, ترجمة يعني. Do you know how much power there is? 30 million advanced laptops and computers, 30 million, just by translating. So like you go from here to which country? Spain, okay, or any other country you want, Pakistan, or wherever you want to go. And imagine it can automatically now learn and can translate. And this is one of my favorite slides I put on LinkedIn almost all the time, and I'll show a similar one tonight, is we're too busy doing things. We can't just stop, think, act, and review. I call it STAR. Stop, think, act, and review, and do something that adds value and make our life better. We try to avoid this unintentionally as human beings, and that opens the change management concept. So digital disruption is needed, and it is my topic today. Before we move into it, innovation has to have, as my dear colleague just presented prior to me, a healthcare outcome and a cost. The value is quality divided by cost. And if the quality and the cost are not going in the right direction, then obviously it's an issue. Artificial intelligence, الذكاء الاصطناعي. Wow, you know, it's like a big word, and you know, everybody is excited about it. Google Map is AI. Facebook is AI. Twitter is AI. Instagram is AI. What do you want me to talk about? You know, Aramex, I just got a delivery, Aramex from the bank, a card. It's AI. Most of what you do on Google or Yahoo or anything else is artificial intelligence. If I give you examples on AI that you don't know about, you will be shocked. Most banks, most industries are based one way or another on some form of AI. So really AI in a simple way is the science and engineering of making intelligent machines. Machines that can do similar things than human beings can do, while human beings created or initiated these tools. So initially, when we talk about this, historically, we have all these things and something called the Dartmouth Conference, where a very famous colleague McCarthy, we call him, spoke about the concept, and bless his soul, it's very important. And I don't know if you know, but one way that the Second World War was won by the colleagues is McCarthy and few others invented the first computer system, and that's how they were able to get Shifra, the information about the German, and that's how Normandy happened, actually. I don't know if you know all of this, but anyway. So they talk about this, great. Are you aware that Al-Khwarizmi is the father of digital health? I'm not gonna look at your hands. How many of you, we have 92 participants. How many of you know that Khwarizmi is the father of digital innovation? How many of you know that algorithm is from Al-Khwarizmi? I don't know if you know, but everything that's going on now digitally is based on three things. Number one is on computer systems that are very powerful. Number two, and most importantly, the bridge is algorithm. And number three is big data management. So it's really the algorithm, in addition to digitizing everything, 0-1 is the foundation. So Al-Khwarizmi is truly the father, not only of algebra, but the father of artificial intelligence, and very importantly, blockchain. So what is AI versus machine learning and deep learning? I'll go a little bit slow and make it a little bit fun, and I hope we can get some information that adds value. So AI, in its newest terms, was initiated in the 1950s, represents simulation of the intelligence in machine. So this is the forest. I'm sure you've heard me say this all the time, and Nashat heard it too many times. Forest, tree, leaf. So the forest, al-ghaba, is the artificial intelligence. AI is a subset of data science. So most of the people who work on this are either data or computer people, IT people. It aimed to build machines which are capable of thinking like humans. So that is artificial intelligence. الفكرة الأولى. الفكرة الثانية. Machine learning. Machine learning, just think about it, for my colleague who do dictations, I don't want to promote a company, but Dragon is one of them. Initially, when you dictate, they don't understand you. Now they dictate a few times, even if you have an accent, even if you are loud or not loud, soft or whatever, it learns and it can quickly do it. Now my Dragon, whatever I say, it can understand better than I understand myself. So machine learning was originated around 10 years after, is the practice of getting machines to make decisions without being programmed. So it can actually add a value. I'll give you a simple example. Facebook will notice that you like flowers, natures, and decent things. It will automatically, through machine learning, learn through some criteria and some people who block some indecent things and some other things that you want the decent, the flowers, and the nature views, if you get the message. So it learns from itself. It's a subset of AI. It aims to make machine learn through data so they can solve problems. Another example is, and I'll give you many examples, is when you read the chest x-ray, it can learn from 1 million x-rays or 1 million views of a tumor on the skin or 1 million views of glaucoma eye or diabetes, what to do. So that is machine learning. The third one is called deep learning, which is actually the most interesting. Deep learning originated 10 years after. It's the process of using AI to solve complex problems. So that's now the more advanced one. It aimed to build a network to discover and solve problems. So I'll show you more examples. Again, just to make sure the concept is clear, an AI program that can sense, reason, and act like our brain. This is the machine learning, the algorithm, Al-Khwarizmi, whose performance can expose to more data and it learns like we learn. Like your muscle learns when you do exercise, literally. And then the multi-layer neural network that can really have vast amount of data and even be a decision maker. So please remember AI, ML, DL. Are you still with me, as I usually say in open conferences? Yes? I can't hear you? Yes. Okay. So why do I show my publications? To show you that the Gulf region, GCC, UAE, Saudi Arabia, and all the beloved countries, all of them are dear to our heart, is more than capable to not only understand and receive knowledge, but innovate it in its own ways. And I will submit to you that between UAE and Saudi Arabia, there's a potential to do things in digital health that are not done even in major countries without really naming. The technical aspects are there, and we have the expertise, the scientific aspect, and also the human aspect, the empathy. So this is a publication on AI looking at safety initially, which is number one with my beloved daughter. The second one is looking at the flow with my beloved daughter. And then Samer looking at diabetes, the disaster that we are talking about. And these have been cited in hundreds and thousands of times. So alhamdulillah, we're doing well in UAE. So this is the first publication, second and third. Give us some examples. Yani, we need to understand. Look at how many. Yes. Okay. Look at how many. Yes.
Yes, sir. You mentioned about your beloved daughter. Could you highlight why the future? How old is your daughter?
So my daughter is 17, mashallah. And again, I admit that she's not in love with AI as I'm doing, but she's very interested. And for them, AI is bread and butter. For them, if you tell them, I used to look for a public phone to make phone call to tell people I'm gonna be late for a few hours, they would look at you as like, what are you talking about? The Flintstones didn't do it. So the point I'm trying to make is their ability to understand these concepts is remarkably fast, and they have a huge potential for leading in this part of the world and the rest of the region and more. So please give our kids, our families, our community as much support as you can, so we can control and make sure AI is going in the right direction, regulated, do it in the right way for our region, our beloved region. Look at the numbers from 2014 to 2021, not even 10 years, and you can see the application. So again, there are many applications. For the interest of time, keeping us well, prevention, early detection, diagnosis, decision-making, treatment, end-of-life care, research. We have several publications on this, training, and we have 4 publications on COVID-19, AI, and blockchain, alhamdulillah. So the benefits, just kind of summarize quickly, can definitely assist physicians in clinical decision-making. Let me give you an example. If you have guidelines coming up on a field, if you are a family physician, it will be from all over. If you are a cardiologist, it will be from cardiac societies and medical and surgical, etc. You cannot keep up. If this goes into our very important colleagues in medical record, and you create a system, it will feed in all these informations as they come, put it in a format that can be analyzed. I'm seeing a patient who's 58-year-old who has heart failure, and I'm like, how do I do the risk here assessment, and which medications are being indicated by the guidelines? This will give me a suggestions of what to do with a plan and an algorithm, but it won't happen till I approve it. So this is what I call healthcare augmented by AI, artificial intelligence. It will only help in replacing or supporting human judgment in some function. For example, if you have a center for visa, for example, that looks at, I don't know, 300,000, 500,000 cases of chest X-ray, and 95% of the chest X-rays are normal. But 5% can have what could be suspicious for either tuberculosis or some prior infection. That can screen the process, double check the process, and create an algorithm for the same. Up-to-date medical information, exactly as I just told you. Experienced versus fresh clinician. Clinicians who are in training, we should not expose our beloved patients without having appropriate supervision. We do have supervision, and I fully support the training of all physicians and healthcare providers. But if you can have another layer to make this safer, then I'll go for it. And then 24/7 availability of expert through digital health and through this. Early diagnosis, I'll show you examples about melanoma, for example, about glaucoma, the #1 reason for blindness, globally, at least in our countries and in the Western world. And looking at, diabetes, I go to Imperial College of London in addition to Cleveland Clinic Abu Dhabi, and it is not unusual, in spite of amazing care, to have blind patients, not because the center was late, but because we were not able to catch these patients early on. This should not be, healthcare should stop being hospital-based or clinic-based. It should be community-based and population-based, and AI is one of the answers. It's a tool, Digital health is a tool. Blockchain is a tool, not a solution, but if appropriately used, it will help us advance. Feedback on treatment. You are giving treatment to cancer patients. So cardio-oncology is one of my expertise. Patients come to me, cure rate is likely to be 90%, 95%, especially with the lymphomas, especially the Hodgkin's, but also the non-Hodgkin's, among other tumors. One of the questions that come up, what's the prediction about how much we can give for this kind of cardiac condition, and can you make appropriate prediction and reinforce non-pharmacological management? I'll give you some examples. Again, reduce diagnostic and therapeutic errors, and also, if done properly, cost saving on the long run. So let me show you an example here how this is done. So the whole idea of, I'm getting excited as you can tell, the whole idea of what we're doing is the pixel. 0 1 كل الدنيا صارت 0 1. That's the computer system, right? So the computer system will have the AI, the machine learning, and the neural network. And it's like the brain, mashallah, although we are the one who is still in control. It will be able to say a dog, put different patterns, and then identify a dog. طبعا our focus is not the dog. Our focus is, for example, a melanoma or an eye problem or whatever. And then it will be able to diagnose it. What is our number one fear, men or women? Never, ever, ever to miss a mammogram on a female, a girl or a lady or a woman, and overread it and put her into a horrible experience, or underread it, which is the ultimate disaster. And it happens, ladies and gentlemen, even when you have 2 readers. If there is a way that we can have another layer of reading, that'll be great. How many mammograms are we going to read? This system can have 20 million mammograms in it if fed appropriately with information, just to give you an idea. This is for a patient with diabetic retinopathy, and this is something huge. I'm not sure if you are aware, but it is top reason for blindness. Again, we're not going to compete between glaucoma, some infections in some countries, and very importantly, diabetes. But it is top. And I just saw a patient a few days ago in Imperial College who was extremely, extremely well treated by my amazing colleagues, diabetic, expert endocrinologist. However, he came late and he didn't know, and he was 61, 62. So, it's so important to detect this. He became very compliant. The care was amazing. The team is amazing. Everybody is amazing. But when you come late, it is late. Similar here is the mammogram to the left. And very importantly, I'm not sure if you are aware, but the whole dilemma of benign versus malignant, moles versus melanomas. Melanoma is among few skin cancers that are extremely lethal, extremely aggressive, but if caught early, can be totally cured, totally. Okay, so I think you can see where we're heading. This is an example of a chest x-ray, like what I told you. Again, algorithm, al-Khwarizmi. I'm not going to go over this in detail. This is regarding glaucoma, missed second leading cause of death worldwide. You will not know if you have glaucoma, as you know. You are in healthcare and you know this thing. But if detected early, it can be treated very well and it can be controlled. So this is great. Now, most people think about, AI as, this is robotic. Robotic really is another area, but it's really a smaller area, not as much as you think it is. What is interesting about robotics and about AI is if you involve mHealth, mobile health. So this phone, the watch that you have, will end up being healthcare, will end up being one acceptable way of research once it's validated. And you remember me for this, and we have a paper on this, on research and blockchain and AI. And now currently, I've diagnosed numerous cases with atrial fibrillation, irregular heartbeat, syncope, who need pacemaker, whatever, simply by doing the screening on the phone and confirming it through more advanced techniques. And there is a lot of learning in this. Just to show you a few examples, and I hope you are having fun. I need maybe 10 more minutes and I will stop. This is the Echo machine. It used to be 400 pounds. Now it's not even a pound. It's even a quarter of a pound. So with that comes the technology. So I hope you can see these things. Just a little bit of fun, some images. Again, it's not just that this is a heart and the images look great. Wallah, it's fun. La. It's much more than this. It truly helps in decision making. When to interfere, make prediction, when to intervene on the valve, when to intervene on something else. Another way to do it is to have imaging that are not only the typical imaging, but also reconstructive imaging. And the third one, just to give you an example, is to look at intricate areas in the heart that can only be seen through artificial intelligence methodology. And I wish I had more time to talk about this. Again, robotic, I spoke about it. Again, one of the key things, whether it's in the cath lab, cardiologist, or wherever you are, is early detection and warning. Too many times, failure to resuscitate, as you know, per the Joint Commission, per the Saudi Council, per my colleague in HCAC in Jordan, per our colleague in Egypt with Ashraf Ismail, who's a dear friend, etc., and many of the Canadian and the Australian, is one of the reasons to consider even a sentinel event, failure to resuscitate. So delay of the warning system could be an issue, and AI can help. And I wish I have time to show you an example. This is just for fun. This is called an intravascular ultrasound, just to show you how the forms can be different. This is an animal, then a mop, then an IVUS. And the idea behind this is it needs learning, machine learning, and that it will be able to understand patterns and make sense out of them. You don't need to worry about this. And just to show you the advancement, take a little bit of fun, Yani. And these are some of the images to show us how you can have actually a virtual image. Now, you have kids. How many of you have kids less than 15? I can't tell, but I guess quite a few. I'm sure you've heard about this concept, so I'm just going to move a little bit fast. Have you heard about, excuse me? Have you heard about augmented reality? طبعا, it's even fun. Do you know that augmented reality now is in the cath lab, in cardiac surgery, in brain surgery, etc., etc.? So you can have literally the image transposed, and you can literally see it in 3-dimensional and intervene. You can also sit in the back and do robotic surgery. You don't have to stand up. You know, we used to be in the cath lab standing up 4 or 5 hours. You can have a nurse or a technician assist you and sit in the back, focus a lot more, make the measurement, and intervene appropriately. Same with cardiac surgery. I don't have to give you all these examples. So really, it's very promising. And then finally, before I go briefly on blockchain and ends, you know, the car, the Tesla, I'm sure you heard, there will be a day, ladies and gentlemen, in few years, where people will say, what did you do before? You used to actually drive the car? Are you serious about it? You remember the stick shift? It will be even, you know, more backward than the stick shift, although I still like stick shift. You know, it will be, you know, the car is there, or it will be augmented car. You still have control. You can steer still, and, you know, but if you have a bike coming up, ducks, animals, somebody pedestrian, somebody blind crossing, etc., you can immediately have a reaction. It will help a lot in road safety. Limitations, obviously, number one is what is AI resistance, and I admit the technical people are not working with the clinicians. There's a lot of jargon. People are uncomfortable. I'm going to lose my job. It is not the right thing to do. But unfortunately, we should call AI not artificial intelligence. We should call it additional innovation, and you should understand how important it is for our healthcare community. Concerns are privacy, obviously should be top-notch. It should be anonymous. It should be ethical, not out of control. Medico-legal issues, who will be liable in case there is an issue with this? And very importantly, it should be regulated. Blockchain, very quickly, for the interest of time, I'll make it super simple. There is internet, there is cloud, and there is a blockchain. Blockchain. It's a block of a chain where you cannot go in unless you have a ledger, you have a permission of going in. It's totally decentralized. For example, my colleague Nashat Nafouri does not want anybody to go into his medical record. He went for a checkup in a dental office, except with his permission. This will create a trust, will create a system where nobody will go into his medical record without a prior permission from him that is signed and documented. So the benefit of this in healthcare, briefly, before I go into a few slides, is number one, and more importantly, that it has trust and it has control. Number two, that it is very specific to the person and has what we call an identity. It identifies a person. Imagine IPSG, International Patient Safety Goal 1. identifying patient correctly, name, medical records. What's the third one? Date of birth. What the fourth one is? Bar coding. So if you are not identifying these, 30% of events documented in the United States on the average are related to misidentification of the patient. So that is huge. So with that in mind, there are numerous applications. The ones that were already done are number one in the field of medical record, because you have complete control. Nobody can go into my medical record. Now, what do? We do random auditing, right? And maybe, you know, punish one or two, or send a warning, etc. This will, by definition, not allow people to go into the record unless they have specification. Second thing, supply chain. How do I know that a product is, you know, in the appropriate format? The vaccine, the COVID vaccine. Not only I want to make sure it's not counterfeit, I want to make sure the temperature was acceptable, right? You have yogurt, and the yogurt says expiration in 4 days. But the yogurt was in the sun. Expiration is in 2 hours. So obviously we need what we call a cold chain. That's the second one. And then the third one, which is very important, we call genomic database. Now with the gene, there are trillions and trillions of data on us human beings. Would you like your gene to be publicized? Obviously not. People can use the gene for very bad things. So you can understand. So this should be fully controlled by the person. It's totally decentralized. The patient is in control for a change. I always say we don't do things on the patient or for the patient. We do things with the patient. So in healthcare, just to show you, give credit to especially Khalid Salah, who is like the third author in this publication. We've had numerous publications and many coming up in this field, looking at blockchain in healthcare. I'll just give you a few examples and then move on and finalize. And I hope you've enjoyed the lecture. Alhamdulillah, technical issues are reasonably okay. So here, accessibility is a lot easier. Accountability is very high. Transparency, everybody would do this. We just wrote a very nice article on research, the way research need to be done using blockchain. Again, blockchain are tubes, blockchain, that create a link of data with so many data, but the link is very well controlled by the person on whom these data are being discussed, like medical record, my own medical record. And I know who goes into my record, and they will not be able to go into my record till I've given permission through some system. Data sharing, personal data privacy, you know, huge. Are you aware of data invasion of data or lack of data privacy in healthcare? I'm sure you are. So I don't have to go over this. We are doing our best, but still we're not there yet. And also will help a lot artificial intelligence and machine learning type. Yani you told us about this, but it's not very clear. What is this? So this is the Bitcoin. We talk about the money. Obviously, I'm not promoting by whatsoever the whole idea of digital money. That's your choice. And there is some fraud in it and something which is right. Again, this is totally not what I'm talking about, but the concept is the same. And these are the steps. All what I want you to remember is there is high trust. It is very well controlled through transactions. There is a ledger, there is an equation, there is a relationship that's very firm. It is very transparent. I can see the whole process anytime if it's on me. And 5, and very importantly, countries like Estonia and Lithuania, for whatever reason, they've used it a lot. And in UAE, it's moving very nicely, in Dubai and Abu Dhabi, etc. They found a remarkable cost saving, going back to my colleague, and the lean and the lack of waste. Again, I'm not going to read this. It's decentralized. It's transparent. It's immutable, means that once the records are stored, they become reserved for a long time. Autonomy, open source, and it's anonymous. So how does it apply in healthcare? Just very, very briefly, is healthcare interoperability data. Cybersecurity is very important. Value-based care, my colleague did an excellent job talking about this, and we all learned from her. And very important, precision medicine. So it's blockchain and AI are solutions, hulul. They are tools, but the problem in the identification of the solution is through improve of processes, looking at process and outcome, looking at other things. These are the tools that help us implement and understand solutions. Again, I'm not going to go over this in great detail, but just to show you it can have remarkable implications. And if I do anything tonight, is at least bring up the concept of blockchain. Again, there is internet, there is cloud. Blockchain is a much more advanced one, just to keep in mind. Now, where does it attach, address me and you and everybody else? The devices, especially in cardiology. As you know now in cardiology, there's no pacemaker that we put where we don't get always non-stop information remotely. So when they come to the clinic, we still look at the pacemaker. But if we're busy, we don't have to, because we have minute by minute, second by second remote monitoring of these devices. These devices have trillions and trillions of data points. Imagine somebody, for your loved one or you or whoever, going into these data, not only the privacy, but even playing with the data and remotely making changes. And then you come to the doctor and the doctor sees something that did not happen and act on it, and the patient will die. And I can give you numerous examples in the Q&A if you want. Not that it happens, but it could happen. So very importantly, and these are many of the examples. I'm not going to go over this in great detail. This is my last slide on blockchain, and I will end. Blockchain technology adoption is growing remarkably. For example, Dubai, all the governmental systems are blockchain based. UAE is moving very much on this. Again, we don't want hypes. We want things that add value, but if done properly, these are digital solutions in healthcare and others that can remarkably help us. Insurance companies love it, especially for billing, because it helps a lot with fraud and waste. It has limitations. Obviously, the most important limitation is you need to have the database, you need to have the tools, you need to have the systems that allow you to use it. I'll just be brief on this so I don't lose your interest. Okay, conclusion. Again, a smile. I'm done. I need 2 more minutes. This is your pilot speaking. I'm working from home today. Anybody would fly with me? Please raise your hand. Okay, you get the joke here, but obviously this is all to put a smile on your face. Now, this is very important. The temptation to follow premature theories based on insufficient data is the disaster of our profession. So again, I'm not proposing to run after the hype or after what's new or after technology for the sake of it. I'm saying let's have control over it, let's own it, let's understand it, let's publish on it, and let's make our region the leader in this very important field. The other concept here, which is very important from Stanford, is hiding within those amounts of data is knowledge that can change our life if we appropriately use the data. There are trillions. Anybody who works in digital medical record will tell you, we don't even know what to do with these data. So this is really important. So this will enable us to have precision medicine. This is preventive medicine. We interfere, we become less reactive, we have more control. It will help us minimize waste if done appropriately. It will help us, again, this is work in progress, detect things, act on things, and go in the right direction. The application of AI ranges throughout what I told you, so there's no need to repeat. And we also spoke about the blockchain. Again, no need to repeat except what I already told you. The future directions, and this is the most important for me, is collaboration between medical and technical institutions. So Cleveland Clinic Abu Dhabi, I'm the physician. Khalifa University, we've been doing this for a couple of years. It's working very well. Stop working in silo. You see the technical people talking, we don't understand. The medical people, they don't understand. Work together. Government funding to have more intelligent and result-oriented. Data need to be captured in real time. New scientific clinical findings need to be coming from our area, not just from our colleagues in the West and the East. And make sure that we simplify, يَسِّرُوا وَلَا تُعَسِّرُوا. We need to go and get engaged. We need to catch up with the technology. We don't need to hide. We need to be acting and leaders in GCC countries. This is us, you and me. UAE is doing this. Saudi Arabia is doing this. And we'll all want to do this. شوية عربي يا دكتور وخلصنا. المثابرون يصلون للقمة. وإن شاء الله كلنا مثابرين. أحب الأعمال أدومها وإن قل. المتميزون يحافظون عليها. أما المبدعون فيصنعون قمما جديدة. So this is what we're hoping to do. And again, please remember the one with the wheel. This is another one. I've got too much work to do, and stop and listen to you. He's cutting with this, which will take forever, and maybe will come over his head, the tree, and there's a tool to help this person. So please, let's help caregivers, communities, our countries, our patient and their family be the best they can. It won't finish till I put my usual slide. Quality is a journey, not a destination. Jazakumullah khairan. I hope I didn't bore you. Thank you.
Thank you very much, Dr. Samer. I tell you, if you could speak until tomorrow, I would be more than happy and delighted and inspired to listen to you. You're gonna be the loser because I will never tell you stop. Simply because you opened a dimension inequality. I would say I rather to comment right now on it rather than having it at the end. Seriously, we are proud that after centuries and centuries, still the Muslim civilization roadmap the future of entire humanity through algorithms. فالفضل هذا الخوارزميات اثبتت انه العصر الحديث زي ما قلنا نحن نتكلم. انا دائما I mentioned this and you were with me in the Abu Dhabi summit when we say the future of the humanity is controlled by 2 digits and 4 letters, where the 2 digits are the 0, 1, which is the basis of all the applications, smart applications, while the 4 bases are the 4 bases of the DNA, which is every now they are revisionalized in healthcare into a new era. So now we see diseases at the cellular level, at the DNA level. So the future is when you put those together with the artificial intelligence and blockchain. I think the future of healthcare is very promising and the quality will play a role, very fundamental role. And I say, you send a message that I'm trying to say through your engagement of your daughter is to teach our children the ethics of artificial intelligence so they could grow with the moral that we have it in our culture, and so the world can learn from them what are the ethics, even though it is the industry is coming from the West. So without any further ado, I would like to thank you. There are questions. We will take it to the end. And I would like to introduce the third speaker. The third speaker is Dr. Hatem Shihab. Dr. Hatem is, you will hear and you will be inspired by his talk because simply I call it a continuous man. Easy to, he goes with the wind, like smooth. And you will see at the same time how hot, how passionate he is when he talk about his subject. Simply why? Because he has this passion toward leadership, toward the human capital development, and that's not because of a coincidence, no, but because he's actually a chief. He's started his career as a in HR. So I would like to introduce him. He's a consultant who works at the Vision Realization Office in the Ministry of Health at Kingdom of Saudi Arabia. He's the Chief Consulting Officer EdCom Bankers Academy in the Middle East. He's the Director of Human Capital Middle East, former at PricewaterhouseCoopers, and as well Arab Bank Training Center Manager. So he has a different backgrounds, and he amalgamate all of these in order to put a new framework, a new dimension to the leadership of new leadership in healthcare. And he will be talking about a unique subject. Really, when he spoke to me about it, I was myself eager to learn more about it, which is positive leadership, taking patient experience to the next level. Please, Dr. Hatem, the floor is yours.
Thank you very much, Dr. Nafuri, and thanks for everybody. I'm really very privileged to be part of this interesting forum and share my experience in positive leadership.
هذا قال لي كان ببلعة من يومين، قال عندكم مش بتجنن.
طيب. Okay. So let me share my screen. Is it showing now?
Inshallah. Yes, it is.
Okay, so the combination of positive leadership and patient experience may be new to many of all of us, including myself, but really from my experience, having worked with the Vision Realization Office, the transformation journey towards 2030 vision, being exposed to also patient experience from different perspectives, including or having to be, if you like, a caregiver, because I have experienced that when when we had to live with some breaking news, personally with my wife being diagnosed with breast cancer. So you go through the whole journey, the whole motion of what it looks like when you are a patient receiving very acute type of medical interventions. So it is not anymore about consultation, is not anymore about transformation, is not anymore about science and methodologies and frameworks. It's about really living the experience of how do you go through the journey and how do you influence that in a positive, negative way. So the combination has served us personally, it has served us professionally. So I will be sharing with you and what is the link or the linkage between positive leadership or positive psychology, which is now a very mature discipline, if you like, and how does that take patient experience to the next level. And when we say to the next level, meaning that patient experience has fully matured and the patients are engaged to find meanings in the journey or healing or getting rid of the disease and etc. But let me on that. And why do we need, before we go into patient journey and positive, why do we need to be positive? Why we have to be positive? We have to be positive simply because life is not easy. Life is full of rocks, full of challenges, full of hurdles that is always challenging us and challenging our intellect, challenging our brains, challenging our energy, and therefore it is not a choice anymore to be positive. We have to be positive because life is simply very hard and very harsh. But if you look at the picture, you can see that a lot of opportunities. There's a lot of things to be, enjoying this life through this. So it shows us even, this type of a very simple, nimble, if you like, rose. It has grown up out of a very harsh rock. Furthermore, it is very important when we talk about positive psychology, because it's a new science, it's maybe 20, 30 years back that has matured. I am reminding you of major poets, Arabic poets, and I intentionally wrote it in Arabic. إلي أبو ماضي معروف إنه شاعر يؤمن بالإيجابية. وعلل النفس بالآمال أرقبها ما أضيق العيش لولا فرصة الأمل. Imagine if we do not have the hope, what will happen to us? If we don't have the belief that there is an opportunity in every challenge that we face, what will be our life? What it will look like? Yes.
ممكن لو تكرمت علي تقفل الكاميرا عشان ناخذ better reception من عندك.
Okay. I will
Thank
do
you,
that.
sir.
Okay, I'll do that. Okay, now?
Yes, sir. Yes, sir.
Okay. So another thing about this, because I want you to feel the importance negatively, because generally we are trained to think negatively, and I will prove to you why we are trained to be negative thinkers. But look, for the complainers, they say أيها الشاكي وما بك داء كن جميلا ترى الوجود جميلا. If you start simply with the performance management system that we have, all organizations, they have a performance management system. The whole thing, the core concept of a performance management system is to identify a gap in performance. And the gap is your supervisor, your team members, they're always looking for something that they say you have a development area, you have a weakness. If you look at even when you are assessing a business, SWOT analysis, and we always focus not on strengths and opportunities, but we focus on threats and challenges and risks and all that stuff. That is not. I'm not suggesting that this is wrong. We need to be risk averse. We cannot be numb towards risk and towards threats and towards challenges and towards hurdles and towards all these type of things. But if you look at the whole system that we are driven on, we are not very much driven to be positive. We are more driven to be negative. And the psychology of positive thinking is about really having an opportunity, thinking about an opportunity among all these challenges. It's really looking at the whole picture, at the whole package. So if you are assessing Hatim Shihab, for example, in the performance management system, instead of just focusing on the gaps, why don't you focus on the whole package? Nobody is perfect. Everybody has a weakness and has a strength. But how about managing the weaknesses through the strength? So the strengths become your arm, your ammunition, to make sure that it surrounds, it sort of demark your weaknesses and make sure that you are managing your weaknesses through capitalizing and augmenting your strength. And that's what the rose, this simple rose, has done. It has grown up in a very challenging environment. Look at the rose. Look at the rose and reflect about yourself. Why you need to be positive. Simply, don't think about positive psychology in terms of its definitions and in terms of its scientific approach and all that stuff. That will come. That is very important. But just look at yourself. Some thoughts, it has some challenges, but at the same time, you are bringing up a lot of hope out of a very harsh and tough environment. So this is just to make sure that we are aligned to what is positive thinking. And frankly speaking, despite the fact that I am sort of, if you like, certified in positive thinking by John Gordon Companies and by Michigan Ross School of Business, my first encounter on positive psychology was many, many years back when I was very, sort of young boy, if you like. I'm still young. I would like to think I'm still young. When I was playing outside in my hometown, Hanabta, in the West Bank of Palestine, and I was having a banana. My father and mother, you can say sort of, they are considered to be well off. They are educated. My father was a headmaster for a college, a very old college in Palestine. My mother is a headmistress for almost 37 years in the teaching profession in our area. So we could afford, if you like, to buy bananas of any amount. So I was having the banana. And then all of a sudden, my mother, I was maybe 8 years old or 9 years old, if I recall correctly. And she was shouting at me from the window, Hatim, come back, just come back. And I was, sort of, telling her that I want to play and I don't want to come back home. In a way, just trying to negotiate what she is calling me for. And she said, no, I just want to, draw your attention to something. She was just saying to me, come back home. I was half through eating the banana, and then she said, Hatim, you either eat the banana inside the house or you get another banana for your neighbor or your friend. He is dying looking at you eating the banana, and we know that they cannot afford to buy the banana. I never understood that until many, many years later. What was that? That was, simply put, the number 8 habit that Covey has introduced, which is called the feeling of abundance. That there is enough banana in our to give you a banana and to give your friend another banana so that you don't tantalize him. And that shows you, how you can embed the concept of abundance, the concept of positivity, looking at life, that, there is enough for me and there is enough for others. Looking at it positively. So yes, we can afford this, but we can also afford to other people. That psychology is very important. So positive psychology is a common sense. Don't worry that you need to go through the certification that I have gone through to be a positive person. You can be a positive person if you think in terms of reasoning and not looking for, finding excuses. So the field of positive psychology, I want you to think about, is really what goes right in life. What is right for you? How do you focus on positive emotions and your strengths? And you promote your individuality, you promote your family, you promote your organization, you promote your community. You are part of a societal flourishing. You're part of a flourishing environment. You make it happen, and that will make your life worth living. That is positive psychology. Now, how does that relate to patient experience, or why we are talking about positive psychology and patient experience? But simply patient experience is what? Simply is looking for hope. Simply is being engaged in a journey that leads to hope, which is medication, which is healing, which is, being right for your body. Because you have a disease, you have a challenge, it's a physical challenge, it could be a mental challenge, a psychological problem or whatever. But let us put it this way, there is a challenge that is affecting your body, it's affecting your brain, it's affecting some part of your body, that you go through that journey and you experience that medication process. But the patient experience is about caring, it's about living, for what is good and what is right in life for you and for your body. And it is not only for you, it is for you and for your family, for your community, because you care about yourself, because you live for others, at least for your mother, for your father, for your children, for your daughters, for your sons, for your wife, for your beloved, whoever you decide, even for God, because that also has, a lot to do with your belief system, and it has a lot to do with your value system. But putting the value system aside, whatever you decide, patient experience is about that. So it seems natural. It seems, something very fundamental, that positive psychology is about how do you fit, the concept of hope and happiness and engagement and, the fortitude and the fight for a good life, with how do you go through the experience in life? Because the experience in life is very, challenging, and but it is challenging, and this brings a lot of beauty to that challenge. So a patient experience becomes positive when you have something that you express your compassion, you involve the patient in the decision-making process, because the journey, they have to be part of the journey. So they engage. It's just like positive psychology. When you create a culture of positivity in the organization, you need to engage the people. You need to engage the staff. So they become part of the recipe. They become part of the making the cake, if you like. They become part of the kitchen making. So positive experience and patient experience is very much aligned to each other, because it's about compassion. The one cares about the staff, and how they think positively. And that's why many of you, if you have heard that many of the leading organizations, for example, I'm just giving, that they have stopped the traditional performance management system because they thought it's stupid, because they thought it does not capture the creativity that is needed, for example, in Google. So they have teams and projects, and they do a lot of continuous coaching to make sure that you are not taken by surprise when somebody breaks the news that you're not doing your job, or you're not entitled for a bonus or for an increase because your performance is poor. It could be poor, but then what did we do about it? Because we are all the time hammering the person that you have a defect, you have a gap, you have a shortcoming, you have a weakness. Let's do a SWOT analysis, and we focus always on the negative sides of the total individual. So we don't accept the person as he is, and we try to shower him with a lot of weaknesses rather than a lot of sort of strength. So this is one example of how do you do that. When you walk into a patient experience journey, many of you, I've been in Saudi Arabia since 1998, and you can see the development. Look at the vaccine, not the vaccine itself, the process, but the process of having the patient experience going through the vaccine process. It's amazing. I'm not promoting Ministry of Health just because I happen to work with the Ministry of Health, but I am so proud that I am connected in any way or any form with the Ministry of Health of Saudi Arabia. And many of you, if you are a Saudis, you always know that the only person who get the most, cases among the ministers of all in Saudi Arabia was, and not is, was the Minister of Health. And now the most person who gets the, commendation and thanks and prayers is the Minister. A person, he happens to be a great leader, but also we're talking about a person who resembles a system, an ecosystem that has gone through a major transformation, one of which is patient experience, the journey. So if you go to the vaccine area, somebody is ushering you where to park your car. Somebody is, is receiving you because you booked your timing or your appointment through an application. So everything is smooth. Then they take you to the vaccine area. Then in each step, you are through a journey. You know where you are in that journey. You are in the area of parking, in the area of reception. You are in the area of vaccine. Then you are after the vaccine watching you. The doctors are just making sure that you have 15 minutes to make sure that you are not, suffering from any side effects. So in every step, yes.
And just for the time, had a reminder, you have 15 minutes more.
Okay. So in every step of the way, you are reminded of what is called a patient journey. So the patient journey is the steps, but the experience you follow with that is very interesting experience. So that is why patient experience is about making the human connection, being mindful of our patients, making sure that we treat them with courtesy, we listen to them, and we provide a clear explanation and care delivery to them that is imposed, that is reinforced by the entire system that is based on the standards. So actually, if you think about it, positive psychology or positive leadership, as it is called, aims to broaden the focus of clinical psychology beyond the suffering of the patients. So if you think about that, if you think about the nurses, if you think about the caregivers, if you think about the doctors, they are not just putting the clinical interventions. They are really putting the clinical psychology into practice by giving the patient safe and high quality compassionate mental and behavioral health. That is the difference between an empathetic doctor, an empathetic nurse, and a person who is just a robot dealing with clinical interventions. And I would like you to remind yourself that الأمراض ليست في الأجساد فقط. بس أنا ما راح أقول لكم الأمراض ممكن تكون وين. Think about it. It could be in your manners. It could be in your values. It could be in anything that you can think about. So let's pause for a couple of seconds between you and yourself, not now, and think where diseases could be. وين ممكن تكون الأمراض? Okay. Now, what is common in between positive psychology and patient experience is about three things. One is care, one is engagement, and one is meaning. Care, we have to care about our staff. That is positive leadership. And we have to care about our patients. We have to get them both engaged. Nurses, doctors, clinical, experts, practitioners, doctors, whoever engaged in the healthcare ecosystem, they have to be engaged in the process. They have to believe in the process. If they are not positively thinking about that process, about that mandate that they have, they would give the worst experience, the worst, delivery that we can think of, the worst service that we can think of. The third thing, which is really very important, is the meaning. How do I feel about the service? Does it mean anything for me? Do I feel that I am receiving just the care and the service, or there is something beyond? And this is where, the whole thing comes. This is the glue, actually, of the care and the engagement. This is how you differentiate between somebody being medicated for cancer in Mayo Clinic and cancer in any other organization. I have never, frankly speaking, I've never understood, patient experience like I understood it the harsh way when the bad news broke to us, and it has changed our life. And then, when they told us that your wife is diagnosed with this, we have to go through a whole motion of a patient experience. It was very tough. But then in some, I don't want to mention, in some experiences, in some, hospitals, they were absolutely garbage. And in others in Riyadh, they were absolutely fantastic. So imagine somebody who is doing a major procurement process, multi-million procurement process, when his wife is under, chemical session, chemical treatment, versus, so this is an experience that I had, versus an experience, the same person who is myself, who is me, who's I, was really going, crazy in another hospital because of the way that we are treated. Ladies sit down, they watch each other, maybe 20, 25 people, ladies in a separate room, in a locked room, and everybody is waiting like for this to happen. So you can imagine the meaning in that. And then, I just want to remind everybody that the sharing between good leadership or positive leadership and experience, patient experience, is around 4 principles, just to summarize. Both are patient employee centered or centric. Both they are clinically led, so we need leadership. Both they require co-production. And lastly, they have to be locally relevant. They have to be Saudized, if you like, in a way that it reflects the culture, it reflects the understanding, it reflects the journey. It really caters for the essence of the community, and not just, bringing all these, templates and methodologies and just bulldozing them into these hospitals and to the ecosystem. So make sure that these underlying principles brings a lot of glue between positive psychology and patient experience. So in patient experience and in positive leadership, we ask almost the same questions. Common questions among both is, are our taken care of? Are they effective? Are they responsive? Are they well led? So these are the 4 areas that bring patient experience and positive psychology together. So if we ask these and we think about, our people and our patient, the way we think about ourselves, we are taking the patient experience to the highest level possible. Meaning, we are providing the care, we are making them engaged, and we provide meaning to that. So we are protecting them from abuse and avoidable harm. We are protecting them by providing them with the treatment and with care. We are responsive because we organize our process around their expectations, and we even exceed their expectations, and we provide leadership. Patient experience is about leadership. It's really about the effect. Mayo Clinic, they have something called Mayo Effect. And Mayo Effect is simply an approach. When you are diagnosed with cancer, I don't want to be, focusing on cancer, but just to give you, because it is the most, horrible thing that could happen according to people's perception, but it's not the worst. If you don't, this is the beauty about it, is that cancer is not the worst thing that could happen to you. Because if you think like that, you would die. You have no hope. Oh, why me? Why my wife? Why my mother? Why my father? If you start asking these questions, then you are thinking that this is the worst thing that you could do. No, there is more worse than cancer. So the Mayo Effect is about really bringing leadership and bringing hope to the people who are diagnosed with acute cancer. So this is where positive psychology, it has to be embedded in the process to make sure that patient journey and patient experience has a meaning, and people do not suffer through that journey. So if you look at benchmarks about patient experience, I'm going to share with you some more slides around that. Engagement, when you are doing positive psychology in a healthcare environment, you are increasing the patient engagement by 40%. Not only the patient, even the clinical staff, they will increase their engagement because they start liking their job. They do it with passion. I know many of the people who are, I'm not questioning the passion of the healthcare workers, they are really passionate people. And rightly, our minister calls them champions, or Abtal Saha. They are really champions. But also we have to champion their opportunities and make sure that they have a meaning to that. They are 5 times much more attached to the service and engaged to the service, and they see meaning in the service than anybody else. They are more happy, and that happiness brings a lot of hope, and that is a major part of the healing process. So if you look at the massive ROI. And when I say ROI here, I don't mean just the financials. I mean the return on expectations, the return on the investment that we have to put. So if you look at the patient satisfaction, it increases because we are dealing with providers. I know in the first session, you have heard a lot about value-based healthcare. And one key issue that Dr. raised, which is very interesting, is fee for service. I'm not going to pay the fee for any medical intervention without making sure that not only I am satisfied, but I'm getting the value of that money. So imagine that money becomes an issue in an accountable care organization that was highlighted by our colleague in the first presentation. So you can see that what she is saying makes a lot of sense, not just only a theory. 86% of the people, they pay more because for a better experience. They are really willing to invest if they have to, and it takes them, through the whole journey of being positively influenced by that. Look at the revenue growth. Revenue growth, it increases. Not necessarily we are talking about revenue in terms of profitability, but in terms of being competitive in the area, it increases. New service offering, all the data that is in front of you tells you one consistent message. When you create a patient-centric culture, you are bound to be taking the patient experience to the next level. You are really making success because you are creating a patient experience that is evolving and that is continuously improving. And the outcome is not just only a patient satisfaction and advocacy for changing the way you are doing the whole thing, but it's also making sure that you are really venturing into new heights. And this is really, and I think my colleague has served me when they said, it's not about, in Arabic, it's not about انت تروح للقمة. It's about how to maintain your position and make it sustainable هذه القمة. فالمتميزين لا يبحثوا بس عن قمم، يعني هذا هم يحافظوا على القمم ودائما بيبحثوا عن قمم جديدة.
دكتور.
Yes. Yes. Any question? Hello?
No question, Dr. Hatem, but just the time, 5 minutes.
Okay, good.
Thank you.
I'm good. So if you guys are interested in making sure that you want to create a culture, embedding positive leadership with a positive psychology with patient experience, just think about this roadmap. You don't have to copy it. You can tweak it. But the key thing about that, who is your stakeholders? What are the key activities and the value proposition that you are, sort of proposing to make sure that you are influencing positively the patient experience or the customer experience, if you like? What relationships you need to build, what channels that you need to choose, what key resources you need, and how much investment you need to put to make sure that this happens. And this is, sort of, you can consider it as a roadmap. In doing so, and before, just closing, I want to leave you with a little bit of an exercise, not necessarily with me now, but later on you can take it on. It's just, according to one of the research, is 90% of the people or the companies or the organization, they say, I want to be customer-centric. I want to be patient-centric. I want to be, employee-centric, if you like. But only, customers, they think that 10% of them are really customer-centric. So you can imagine the disconnect between the expectations of the patients, of the customers. This is not patients, this is customers, actually. The difference, the gap, and how much we have to do to make sure that such culture is created. And it has to be created on a solid basis, not on a, and that leads me to, the final slide, which I want to tantalize your brains with. Think about this tree. I know it has 4 segments, but think about this tree in terms of, decide for yourself. What are the fruits that you are investing on and how much time you are spending on that? For example, revenue, cost cutting, strategy, values, norms, stories, policies, procedures, communication, formal or informal. I'm just giving you examples of many, many things. Think about it in the context of healthcare. Where are you putting your energy? So take this picture and put all the things. Performance management system, is it a root or a fruit? How are you putting, how much you are putting? If you are looking at yourself, how much you are thinking about your deficiencies and about your weaknesses versus your strength? How much you are, focusing on your strength to make sure that you manage your, your weaknesses. And then think about that. In healthcare, for example, we have major 4 interventions in healthcare. One is the self-care. One is the primary care. One is the tertiary care, which is, very specialized, sort of intervention. And then, اللي هو العلاج الثانوي, secondary care. And think about that. This isn't just a solution. Where you need to invest. We have to invest in the self-care. So patient experience is not just about having the medication. It's about psychologically influencing and changing the perception of the patient to be taking care of himself, managing his whole body, managing his whole soul, managing his mental well-being. So when you think about positive psychology, it's about positive influence. It's about how do you manage the expectations of somebody who is coming just for medication and he wants everything to be, given to him without maybe, exercising the necessary challenge and the necessary fortitude to make sure that he is taking care of himself. So my conclusion to you is make sure that not just, being caring about yourself, but making sure that you are positively looking at your whole body, your whole soul, your whole well-being, that it has a meaning, that you become engaged. You're not alone sick. There is a part in your body that is sick. So think about that and make sure that positive psychology, whether you are, you know, studying it scientifically or just by common sense, and I prefer by common sense because you know we saw that in the beginning of the presentation that you can influence that by thinking reasonably. Reasoning is very important. Don't look for for excuses. Make sure that your life has a meaning. And make sure my statement to you, نام وأنت تحلم بس اصحى الصبح على هدف تحققه. There is no issue if you go to sleep dreaming, but wake up for a goal to be accomplished. That is positive psychology. And thank you very much. I hope I closed on the right time.
والله on the spot دكتور حاتم الوعدي شكرا جزيلا يعني I took so many notes from this presentation. Now if I have the time, we still have 5 minutes to share with the audience. I hope now my slides could open and we could share the just annual report اللي هو الآن screen share here I say. دكتور محمد بلغني إذا ظهرت عندنا السلايدز.
ظهرت يا دكتور، تفضل بس كبر الشاشة لو سمحت.
أنا حكبر الشاشة إن شاء الله. حكبر الشاشة ونتكلم عنها. حستخدم الشاشة اللي قال لي عليها الزميل عن ما حخليها سلايد شو.
ممكن سلايد شو إذا ما في أنيميشن يا دكتور.
لا ما في أنيميشن، ما في. just view. Okay. Just to tell you about the health interest group, هذه ما فيها animation آخر حاجة, just to emphasize on the digits and the 4 bases, which is the motive of this event. And as you could see, the health interest group since 2003, that's the first logo, until we reach now the 15 years. Now we are in our 19 years in 2018. If you want to know more about us, please visit SaudiQualityCouncil.org.sa. And our vision, رؤيتنا مكتوبة حتى باللغة العربية، أن نكون من أوائل، وليس لا نريد أن نكون الرواد بس من أوائل الرواد في المجتمع الصحي المهتمين برفع الوعي بأهمية تطبيق ثقافة الجودة في الخدمات الصحية بكافة مجالاتها. عندنا 5 أهداف من رفع الوعي للتواصل مع الزملاء زي ما شفنا اليوم، أو التواجد في أي تنظيم معنوي أو تنظيمي لمؤتمر أو إيفنت. وهذا ما شاء الله أنا خلال المحاضرات الزملاء أنا كنت بمشي على الحضور، واعرف انه مثلا ما شاء الله عندنا الحضور من معنا مديره الجوده في المديريه الدكتوره فوزيه، معنا زملاء كثير I could see them كانوا موجودين في المحاضرين، معنا زملاء من الحرس الوطني، يعني ما شاء الله من كل بستان زهره كان موجود معنا. وهذا التواجد هو اساس وفاليو، قيمه من اهداف المجموعه الصحيه ومد جسور التواصل مع المجتمع العام، لأنه الجودة تعكس المجال، تعكس لها حياة على الكواليتي اوف لايف. طيب نجي إلى طبعا ركائز النجاح، لابد لنا أن يكون في، نرجع للفضل. طبعا هذه المجموعة اللي أسست معنا، لكن الآن عندنا العدد أكبر مع الحضور، وأتمنى أنه أي أحد يرغب في أنه يشارك مع المجموعة، في من رحل من هذا الجروب، وفي من تقاعد، وفي من تطور في مجاله المهني، وفي ما هو اللي نسميه نحن صوت العميل الدكتور فتياني، اللي هو دائما نسمع له عشان نقيس تجربة المريض بالنسبة له. طبعا تعلمنا من الدكتور سامر انه الداتا از باور ان كواليتي ارينا. نحن نشتغل كسكول اوف فيش. فنحن الاوتكم until 2019 هلا 2020 as you can see we have over not this is 350 individual members. I believe now we are more. We co-organized more than 250 quality events locally, regionally, and internationally. More than 25,000 professional participation and transaction, and more than 100,000 volunteering educational contact hours over the last 15 years, even more now. And lastly, but not least, we celebrated the 15 with the pioneers who hosted. أنا أشكر زملائي في مدينة الملك عبد العزيز الطبية بالحرس الوطني اللي ساعدونا إنه نكون والله هذه المجموعة يكون فيها نخبة كبيرة من كافة القطاعات، وكان هذا الاحتفال بحضور الجميع. نتمنى أنه نرجع من عصر الكورونا ونرجع نتجمع ثاني بإذن الله، وتشوف الأعضاء الجدد ونكسب أكبر عدد ممكن من الزملاء في هذا المجموعة. اقتراحاتكم وآرائكم هي ركيزة النجاح لنا. ف you have a voice, would like to hear from you. أنا هذا إيميلي موجود، أي تعليق أي future plans هذا please feel free to email me or you feel free to email info@sqc.org.sa. هذا للمجلس وهذا إيميلي الشخصي. أنا أؤمن في سياسة الباب المفتوح وهي عن طريق الإيميل، وإن شاء الله نكون عند حسن الظن. شكرا جزيلا. نرجع إلى السيمبوزيوم. Few notes I have taken from the colleagues. ممكن يشاركون الكوليجز for هذا مشان الأسئلة. أنا I could see their أسئلة. You could open the cameras, colleagues. طبعا دكتور ايوه شهاب اهلا. طبعا نحن thank you دكتورة نهى. It was a very interesting and impressive presentation about the value in healthcare. To summarize, I like to just take a summary of one word or one sentence of the presentation I learned from you today. I grasped and tried to concentrate that engaging patient through patient experience in all clinical or non-clinical processes is a mandatory, because the patient is underutilized as a very important resource. That's a key message I took from you. Another key message I took from you is that new quality tools are such as Lean and Six Sigma are not anymore a luxury tool, but it's a moving forcefully in healthcare to be implemented and to be adopted by modern healthcare. هذه two messages I would come to my ايش اقول from heart to heart دكتور سامر, from البطين الايمن والبطين الايسر الى كافه الاذينين, عشان انت بتضخ ما بتضخ دم, بتضخ كواليتي. ف I would say I learned from you that in order to flourish we need to engage technology and as well with education, learning. So that's here we need to learn from other industries, amalgamate knowledge from universities and computer sciences, security, cyber security. So we stop working in silos. No, it is a maximization, in my opinion, to the entire teamwork. So you expand the teamwork beyond the boundaries of your facilities, and you partnership with other industries in order for the artificial intelligence to work. And as well, thank you for reminding us always with our roots that the civilization still pay respect to our civilization, the Muslim civilization, where Al-Khwarizmi I'm sure he didn't know, ولكن طبعا نحن أمة أنه نعمل في كل شيء يوضع في ميزان حسناتنا أو في ميزاننا الثقيل إلى يوم القيامة، فالله يجعل ميزان حسناته هذا في ميزان حسنات الخوارزمي كعالم وميزان من تبعه، لأنه هذا علم ينتفع به. طبعا المحاضرة الثالثة كانت inspiring لكل ليدر. كل ليدر يفكر في البوزيتيف leadership should focus on something I would say how to be empathetic not sympathetic. لكن نحن وبالترجمة هذه دائما الله يذكره بالخير بروف زايري دائما he says empathy or sympathy, and to translate him what is the right translation in Arabic. ولكن أنا أقول إنه نحن نتعاطف كبشر في رحلة الشفاء وليس بدواعي الشفقة. الهيلث كير اتس نوت الشفقة. يمكن أنت إذا شفت حادث تتحرك المشاعر الإنسانية، ولكن تعاطفنا كبشر في رحلة الشفاء هذا جدا مهم. وأتمنى إنه يكون التحويل ما بين البيشنت اكسبيرينس إلى حاجة نسميها patient healing journey. لأنه البيشنت experience it could be a good experience or bad experience. So now, but when thinking positively now, inspired from your presentation, why we don't call it patient healing journey? So we have this positive energy with us all the time. And to transform as well, it's a human journey. Three altogether. If I put you all together, you spoke about the human journey and how to make our environment sustainable as well. So thank you very much. I do have a question from the audience, if not so many questions. We'll start with this question to Dr. Samer, I believe. One Al-Akh Muhammad Humaysh is asking, artificial intelligence is prediction that has accuracy and precision based on goodness of fit of data model. What are the risks on human life and limitations?
Okay, so first, thank you for asking the question. Second, one of the application of artificial intelligence, only one, is to have a better prediction based on large amount of data, hard algorithm, and the ability to have a more scientific prediction. So for the team to understand, if I have a patient with kidney disease, they need to be on, get a coronary angiogram, or a patient who's gonna get chemotherapy and will need a medication that may affect the heart and make it weaker. هلا بنعمل estimate based on data and we give the same number. Precision medicine, we would say based on 10 million patients or 1 million patients, we can predict that the risk is so and so. The risk of AI طبعا is like anything else. So I'll quickly say 5 things and stop. أول شيء إنه to use it for the sake of using it. إنه technology and we want to sell and not to really apply it appropriately. Number 2, garbage in, garbage out in everything, including AI. So if the information is not accurate, if the information is not well used, if we have a structure, process, and outcome that's not aligned, this will be a risk. 3, طبعا, initially to initiate all of this, there is a certain amount of investment financially that needs to be there. So يعني chapter 1, finance is in, طبعا, but long term, it should be very, very reasonable. Number 4 is يقولون ما لا يفعلون أو يتكلمون على ما يدرون. So many people talk about AI as if it's something that they master, and I think all of us are students in this field, and we need to be very humble, and technology need to work with clinician. Finally, the model that I propose is very simple. It's being applied in Cleveland Clinic and in Mayo Clinic. We have in the team that is rounding an AI technical person and an AI clinical person. They identify clinical areas and they make a prediction. For example, one thing from Mayo Clinic, EKG predicting heart failure. You can look up the publication in Nature magazine. And they were able to detect it in an amazing way. And the patient who didn't have heart failure with LV dysfunction ended up having LV dysfunction in 2 years, I'm sorry. So this is the summary. جيدة جدا، واعدة جدا، هي الحاضر وليس المستقبل، الدقة ضرورية والحذر ضروري. And it needs to be regulated. شكرا.
Thank you, Dr. Samer. Another question for you. I told you this subject will open a lot of questions. We have a question from Deep Al-Salim asking, what do you think about future of IoT, Internet of Things?
So I did show a slide يعني of this. It's يعني باختصار, I don't know how much time we have because for my other colleague, it's very promising. Wallah, the same concept. It is here to stay. It is not a hype, it's real. It will work very well. We need to understand it and adopt it. And هلا يعني I got some of my colleagues send messages and know how do we get a formal training in AI in addition to the medical care. And I have an amazing medical student in Sharjah, and he knows who he is, who I think will be ideal because he's a very technical person and a brilliant physician and a resident. So باختصار, we need to build it from our own area. It will give us a lot of benefit. There are some issues about it. I was discussing with Dr. Khalid Salah on last Thursday at 1 p.m. how to have Internet of Things with blockchain and put it with AI in a way that can be applied. I wish we had more time. I'll give you many examples. Thank you.
Thank you, Doctor. دكتورة نهى, بالنسبة للadded value, how many you mentioned about the approach, the integrated value. How many hospitals in the kingdom adopted the approach? Are there any examples from the kingdom about the new approaches you presented in your lecture? Or at least similar?
Well, exactly as systems, I'm not sure because I didn't search on it. But I believe there are multiple private healthcare sectors that have implemented such a thing. Like, for example, big organizations like Faqih, Sulaiman Habib, probably they have implemented some integrated healthcare system. Ministry of Health, I think, is going toward that.
I have noticed, حضرتك, you mentioned about Six Sigma and the Lean. Samira, I know Samira and I, we are big on Lean in a lot of things. Hatta we say how to tender your processes, like tenderloin, make them tenderloin. So, from your experience, now the industry, when it comes to the private versus, especially we are moving toward transformation and moving toward privatization. Do you think a balanced scorecard, which is more adaptable than the Six Sigma in the healthcare business?
Yeah, I think balanced scorecard is more effective in business rather than healthcare. So in healthcare, we can use the AAA to set the KPIs, and probably we can use more other methodologies like Six Sigma, like you said, and
دكتور حاتم، شو رايك بحكم انك انت شغال كمان في البنوك؟ اشتغلت مع شركات الكونسلتنج، فالبالانس سكور كارد in healthcare, is it a promising perspective as a quality tool? لو تحرك المايك، بس المايك نحن مو سامعينك، unmute المايك. Still muted. ايوه نعم.
انا بقول it's yes and no لانه it's السكور كارد هيستوريكلي اخذ يعني 4 جوانب رئيسيه بشكل خلينا نقول متوازن بما فيها الفاينانشالز بالهيلث كير سيكتور. while we are moving into a health يعني value based وفيها financial وفيها revenue وفيها accountability, بس we have to be very careful with that dimension لأنه الهدف النهائي ليس تحقيق الربح، وإنه هو تحقيق الأثر الطبي على المريض، زي هو تحقيق الأثر الاجتماعي مثلا القطاع الثالث. فلذلك the scorecard has to be tweaked in a way a revenue generating process من خلال احنا الآن أسسنا يعني اللي هي الجهة اللي راح تشتري الخدمات الطبية وتعطيها للبروفايدرز، ما راح تيجي من وزارة الصحة، وزارة الصحة راح تكون ريجوليتر. ولذلك the way we are managing our revenue راح تكون activity based process، بس it has to be driven by the effect of the medication, the value of the healthcare services, rather than generating the process of revenue يعني accumulation. فلذلك the scorecard, and I think it's a very promising tool. وطبعا people are not aware of that. هذا تطور في السكور كارد. هذا يعني انه حتى اصحاب الفكر اللي بالسكور كارد they are evolving the scorecard process to be انه ما يكونش فقط كوادرانت 25% 25% 25% اللي هي الفور dimensions of the scorecard. So I think انه it has to be tweaked, it has to be نفس الفكره اللي حكيناها, it has to be Saudi relevant. تتذكر لما حكينا كيف فانا I think we have to be very careful. بس انا I am يعني خلينا نقول يعني انا بدافع عن السكور كارد لانه it's a management and strategy tool. Some of the KPIs we have to be very careful لانه قد يفتح شهيه القطاع الخاص بتحقيق ريفينيو على حساب الفاليو. فانا I think يعني انا يمكن انا يعني متعاطف مع الدكتوره يعني انه الموضوع الفاليو بيست هيلث كير بدنا نكون حذرين فيه. We have to reinforce the value rather the value of the service rather than the revenue of the service.
Excellent. I think we do have, I will take a couple of questions just to, because of the time, for the sake of the time. في عندي الأخت جواهر خسيفان. There were two abbreviations Dr. Noha mentioned. Would you mind mention them again without explanation? That's اللي هي what is the prim and that slide, Dr. If you can put the abbreviation first to mention them.
Sure, I'm going to share the screen while I'm answering. Just a second.
Okay, طيب. Okay. By the time yes, تفضلي. Yes.
Okay, so it's Proms and Friends.
السؤال اللي كان عليها سؤال أعتقد.
It's there. Yes, so it's Proms and Friends. And Proms is patient-reported outcome measures, and Friends is patient-reported experience measures. And those are both measures for outcome of healthcare as reported by patients.
Okay, thank you very much. دكتور سامر لك رسالة من الأخ عبد الحميد عثمان. He's saying thank you for this highly informative lecture. I learned a lot from it and other lecture. So he's thanking all the speakers. Is there a connection between business intelligence and artificial intelligence?
Oh, how many hours do we have?
Wrapping up.
I mean, this is a conference topic. طبعا, the answer is yes. So, you know, briefly speaking, it's all talking about data, making sense of data, having quality data. Data could be structure, process, or outcome, as some of my colleagues mentioned nicely. It can be tactical or strategic, like the scorecard that we were discussing. And the business intelligence component can be looked at in two ways with the topic, and I will end with this. It can look at the blockchain, which is a block of chains where we have high trust, immunity, and significant control and transparency, HIJIHA, and cyber security that's quite high. On the other hand, artificial intelligence will take the data as a forest, will have a machine learning that can learn from this and process, have a neural network that can give sense to this and either diagnose or make prediction or help in treatment. ملخص يعني. شكرا.
شكرا دكتور سامر. To answer الأخت هبة السالم اللي she said, are we going to see more smart hospitals? Any importance to provide? I can tell you, with having more AI applications and blockchains, for sure, I could see just, I give you the example of COVID. Before COVID, الوزارة كان يمكن عندها تطبيقات تختلف، لكن في فترة الكوفيد على الأقل لاحظي أنت الخليج الحبيب بالكامل بما فيه المملكة الحبيبة طلعنا على الأقل 5 تطبيقات على الأقل. هذا إذا صحتي، بدينا في صحتي والآن اعتمرنا، والآن في الهيلث كير والله حتى لا تحضر الكلمة الهيلث كير. فبالتالي yes, you will see a more smart hospital. My concern only about this is, and this is a lecture I presented with a colleague during last year Quality Week, Director of Healthcare, how we would regulate artificial intelligence so people don't fear to have a new set of skills rather than the fear of leaving their jobs because they are losing jobs because of artificial intelligence. I think that's the biggest challenge. في آخر تعليق وصلني أنا من الأخ أيمن عشرة. about the efficiency and your slides, Doctora, slides number 13 about the efficiency, the debate about wallahi efficiency by the definition of ISO is the relationship between results achieved and the resources used. So the healthcare value for that will not depend on efficiency. طبعا تعريف الefficiency in the ISO and healthcare, of course, when we talk about efficiency, أخي الفاضل, insurance, they have at one point we have to calculate wallahi what is the value of the services that have been offered or how much. So yani, I don't want to mix between the value, which is the tangible value, which is the fund, and the efficiency in the processes itself. When we speak, you are absolutely right from the ISO point of view. And what Doctora mentioned is reducing the waste. We are increasing the efficiency. That's, I believe, this is the questions. And I know that there are more questions that colleagues could share through the council, their emails and exchange information. I would like to thank you, our colleagues here as well, putting ads for you for the next workshop and the next next event. And ask you to, in case you are interested to attend these. أباركونا. طبعا أنتم ملاحظين جنب المجلس السعودي وشعار المجموعة بدأ يظهر شعار الوقف. يمكن أنا أعتز بالمجموعة هذه الصحية، زملائي المحاضرين، هذه رسالة تأخذوها، إنه المجلس السعودي هو أول مجلس في العالم العربي، إذا لم يكن في العالم كله، اللي عمل وقف للجودة. هذا الوقف وإن شاء الله هذا تشوفوا نتائج هذا التحول، وعما قريب أصبح عندنا وقف الإتقان والجودة كمنظومة إن شاء الله مستقبلية لكافة أعمال المجلس السعودي للجودة بإذن الله. أشكركم في نهاية هذا اللقاء. إذا في أحد من زملائي من اللجنة التنفيذية يحب يضيف أي ملاحظة أو أي تعليق حياه الله. نقدر نقول لكم إذا ما في أي حاجة تسمحون على خير.
بس نذكر دكتور، بس احنا عرضنا وكثير جتنا أسئلة عن موضوع السيرتيفيكيت. تحول 50 ريال. قبل شوي كنا عارضين طريقة التحويل، وهي 50 ريال لطلب السيرتيفيكيت، وبعدها يتواصل مع info@skisheet.org أو أيضا يتواصل عن طريق الواتساب مع الرقم المعلن في كل إعلاناتنا. كل البروشور حق الإعلانات موجود فيه رقم واتساب، تتواصلوا مع هذا الرقم إضافة إلى الانفو إذا مثلا ما وصلت الرسالة. بعد التحويل ترفقون صورة الإيداع 50 ريال لطلب الشهادة مع الاسم، مع ذكر رقم العضوية إذا كان عضو، والاسم حسب ما يريد ظهوره في الشهادة. شكرا لكم جميعا، شكرا للأساتذة المحاضرين، يعطيكم العافية، دائما متميزين في الجودة في الصحة.
الله يسلمك. أخيرا ليس آخرا، سامر تصبح على خير. almost الساعة 12 في أبو ظبي. دكتورة، نتمنى لكم شكرا جزيلا على الوقت، وأنا عارف you are a mother of children so they by the way they إن شاء الله يكون سلام. ناموا. دكتور حاتم، الأجواء كيف؟ باردة عندك؟ تغطى كويس إن شاء الله، والمشمش لما يصير وقته ننزل على طول كرم بإذن الله وناكلوا مع بعض. حياكم الله والله يخليكم ويجعله في ميزان حسناتكم جميعا إن شاء الله. تصبحون على خير.
مع السلامة. شكرا دكتور.
مع السلامة. مع السلامة.